Hi, good afternoon. My name is Theo Sloots. I'm the Director of the Queensland Paediatric Infectious Diseases Laboratory, and I'd like to take this opportunity to tell you a little about the research that's being conducted in our laboratory. Essentially, our laboratory works towards improving the health of children at the Royal Children's Hospital. And we do this through research and development. And essentially, we work in 3 or 4 main areas. First of all, we improve the diagnosis and detection of infectious diseases in children through developing better diagnostic assays. And a good example of that is a new assay we developed for meningococcal disease. Secondly, we have a particular interest in respiratory disease in children, and we strive to characterize and identify the viruses that can cause respiratory infections in young children particularly. And as a result of that research, we've actually discovered a number of new viruses and are conducting further research to try and characterize those. Another important part of our research is looking at the bacterial infections in children with cystic fibrosis. And one bacteria in particular, Pseudomonas, is very important in children with cystic fibrosis and has shortened their lifespan in the past. But some of the research that's being conducted here and in other places has significantly increased their life expectancy. And we're trying to understand more about the mechanism in which this particular bacteria causes lung infections in these children. So those are the 3 main areas. And then the 4th area where we're really operating in more recently is we're conducting clinical trials. And what we have is we have drug companies that have new drugs for infectious diseases that they would like to try in patients. And generally we get them at a stage where they're very safe. So they've already been trialled for safety and efficacy, and they just want to, the drug companies just want to see that they work as expected in the population which is ultimately being targeted. And we have about 4 or 5 people working in this area, and we're testing about half a dozen different new drugs for the drug companies. So essentially, in a nutshell, that's what we do in the Queensland Paediatric Infectious Diseases Laboratory. We are very active in improving the health of Queensland children, and we hope that through your donations and generous support, we will be able to continue to do that well into the future. Thank you very much.